All right, that was my nuts and bolts, and I'd like to go ahead and welcome our presenters to just introduce yourself and take it away. Anthony, go ahead.
Thanks, Kara. Hi, everybody. I'm Tony Newman. I'm the director of the Division of Senior Disability Service here at the Alaska Department of Health. Kara, thanks for your help getting us set up, and thanks everyone for being here today. I'm going to turn it over to our partners at Ring MD in a moment, but I wanted to give you a little bit of background as to how we arrived at this webinar today. As many of you know, the department has been deeply interested in improving services for Alaskans with complex care needs, as people in need of services that cross divisions, sometimes cross departments, and too often has led to uncertainty over how to best serve them. At SDS, this typically means people who are on one of our home and community-based waivers and who have behavioral health challenges or medical issues and other things that can make it challenging for their families, for their caregivers, for themselves to get the services and supports they need to keep them safe and comfortable in their home and community settings. So we have done a variety of things over the past couple of years to try and do better by these folks, and that has included using American Rescue Plan Act funding where we could. This is federal funding that we've used. Last year, we created a program to support environmental modifications in assisted living homes, serving individuals with complex needs. We've also been using it to support the Division of Behavioral Health's Complex Behavioral Collaborative for people on home and community-based waivers. The impetus for the project that we're going to discuss today came from speaking with other states that have used ARPA money to establish similar telehealth services for their IDD populations. A couple years ago, Lynn Kyleman Cruz, our former deputy director, who was with SDS at the time, she and I started hearing from these states that these kind of services have been successful in reducing emergency room visits by their IDD waiver participants. It might seem like a simple thing to do to establish a telehealth service like this, but a lot of work was needed to get us to today. It involved getting approval from CMS, conducting an open and proper solicitation, getting security clearance from the department, and much more work. And I'd like to thank Zach Easler, who is a manager in our IDD unit, for taking on this as a special project and teasing through all the details. And he had assistance from Heather Cord, Pam Burton, and Caroline Hogan with that work, as well as the procurement and IT folks here at the department. We are going to be gauging usage throughout the period of this project, and if it's well utilized, we'll be looking to continue this for the long term. So at SDS, we're really interested in hearing about your experience, and the experience of anyone who uses this service over the next weeks and months. So with that, I'm going to turn it over to Ring MD, Amanda, and Varun. Go ahead.
Thanks, Tony. I appreciate it. Hi, everyone. It's so nice to see you all here. My name is Amanda Schweizer. I am the Director of Program Operations with RingMD, and I will be presenting to you today about our platform. But first, I would like to pass it over to my colleagues, Varun and Lisa, to introduce themselves. So Varun, would you like to start?
Sure. Thank you everyone for joining us today. I'm Varun Arora, Chief Operating Officer for RingMD. We proudly serve the federal and state governments on programs like this in telehealth, and we've got a number of years of experience in Alaska already. We work with Indian Health Services under Department of Health and Human Services with the federal government, and so we serve a lot of citizens of Alaska at this time already with telehealth services, and very excited about this program and how we can continue our service and grow our what we offer in Alaska. Joined by Lisa as well, who can share a little bit about herself too.
Hello, everyone. I'm Lisa Wilkinson. I come to you with over 20 years experience in behavioral health with the IDD and severe mental health population. I am working with Ring MD on this exciting new project, helping to train our triage staff, and I'm excited to meet you all and be a member of the team. Hi, everyone.
Thank you both. All right, let me share my screen, so give me 1 minute. Okay, are you able to see that? Yeah, I see some thumbs up. Okay, we're good. All right. So again, it's just so wonderful to be with you all, and we just want to reiterate how grateful we are to spend this time with you. So this program was created with one purpose in mind: to bring behavioral health support closer to your families. So no matter where you live, what your schedule looks like, or what challenges come up day to day, I'm going to share what this platform is, how it works, and more importantly, how it can make life a little easier for you and your loved ones. So we see what you're carrying every day. And so before we talk about services or features, I really would like to start with you. Families in Alaska do so much, so often more than people realize. Many of you are juggling school schedules, full-time jobs, medical appointments, and complex behavioral needs with your loved ones. You're driving long distances or waiting weeks, even months to get the right support. And on top of that, you're managing multiple systems, multiple providers, and sometimes multiple crises. So we just really want you to know that we see you. We see the weight that you're carrying and the love behind it. And our goal with this program is simple: to bring you support and to make your world just a little bit easier to navigate. So I don't have to be the one to tell you that Alaska's geography creates challenges that most states simply do not face. So the distances, the weather, the availability of specialists, all of it makes accessing care incredibly difficult. And so for individuals with IDD, these challenges are even more pronounced. We see higher rates of crisis, ER visits, and hospitalizations simply because the right kind of support wasn't reachable at the right time. But we believe that geography should never decide who gets help. And that is truly the heart of this program: removing barriers that you shouldn't have to fight through. And that leads us to the program itself. So the Alaska IDD telehealth platform. First and foremost, this is a service built specifically for individuals on the IDD or ISW waiver. And so that means it's completely free for those on those waivers. Every provider on the platform is trained and experienced in working with individuals with IDD. And most importantly, there's support available 24 hours a day, 7 days a week. So whether it's during the day, after work, on the weekend, the middle of the night, if something is happening, you're not alone. You're here. We're here with our support. All right, so what does the program give you? We like to make this simple and explaining the platform with what we call the 3 Cs. So that is connectivity and access, crisis intervention, and continuity of care. So connectivity and access, you can reach a trained provider anytime, anywhere, whether you're at home, in a group home, or on the go. We have support at your fingertips. Crisis intervention. When things do escalate, because crises can happen, you can get immediate specialized behavioral health guidance to help de-escalate and determine next steps. So our goal is always to help your loved ones stabilize safely, and when appropriate, avoid unnecessary ER visits. And then the 3rd C is continuity of care. The same platform follows your loved one across visits, so you don't have to retell the entire story every time. This support helps strengthen stability and reduce setbacks. All right, using the platform. So you may be asking yourself, what exactly can we use the platform for? Here are just a few examples to get you started, but it's not limited to these examples whatsoever. So between appointment support. So sometimes weekly therapy just isn't enough. If your loved one becomes agitated or their behavior suddenly escalates, you can reach out right away for de-escalation and coaching. When appointments are weeks away, if you're noticing changes in sleep, anxiety, mood, behavior, and your next appointment is far out, the platform gives you faster access to behavioral health support, so things don't spiral in between your appointment times. Rural access without travel. So for families who live far from town or in areas with tough weather, you can meet with IDD trained providers without any travel. No flights, no long drives, no cancellations. And then finally, IDD expertise. So expertise that you can trust. Every provider on this platform understands IDD. They know how to communicate, how to adapt strategies, how to support you in a way that actually fits your loved one. This is specialized care designed for your family, not generic mental health support. And so what this really means at the end of the day, we're trying to turn these barriers into breakthroughs. Any of the challenges that once stood in the way, whether it was long distance, long wait times, canceled appointments, limited local providers, these all start to fall away. So again, just to reiterate, we gave you 24/7 virtual access, you get more stability, you get consistent support, and your loved one gets the cares that they deserve. All right, how do we get started? So it's very simple. Step one, you're already doing it today, which is great. Learn about the program. So anything that we don't cover in this presentation, we'll have time at the end to ask questions. Feel free to ask us any questions to us, your care coordinator. You can send them in offline if they come to you later. We want you to feel confident in our services, so we're very happy and welcome any question that you may have. Step two, enrolling your loved one. Your care coordinator can help you fill out a simple enrollment form. Today, we'll show you exactly how to do that on your own and log in and what to expect during a visit. And three, scheduling or requesting a visit. So getting started. Once you're enrolled, you can schedule a practice call to get comfortable with how it works. Or you just use it when you need to. We definitely recommend you getting started before you really need to use the platform, so you know how to use it when you need it. But really, it's there when you're ready to utilize it. Either way, it's perfectly fine. Okay, that wraps my presentation. I'm going to get us through a quick demo, show you how to access the website and the platform. And then after that, we'll open up to any questions. Sound good? I can't see anyone, but I'm going to hope that's okay. All right, let me reshare my screen so we can get to the platform. All right, are you able to see my screen? Yes? Okay, cool. I can see you all again, which is great. All right, so this is the Alaska IDD telehealth platform. How you can access this is this URL that you see here, health.alaska.gov/IDD telehealth, and then it'll bring you to this main page. There are two options on this page that I want to bring your attention to. So you can request a call with a profile. This is how you sign up. You fill out your enrollment form. This is how you create your profile. You can request a call as a guest if you need immediate crisis support and you haven't been able to submit a form previously. And I'll show you what that looks like. Actually, I'm not going to jump ahead. So let's say you're coming in, getting ready to fill out an enrollment form. You would type in your email address. Okay. Then what it'll do is it's going to send you a one-time passcode to the email that you just submitted. So I'm going to get that passcode from my email. Okay. 392978. So once you put that in, you hit submit. If for any reason you can't find this code, it goes to your spam or chunk folder, you'll get a new code within a minute. So just be on the lookout for that. If for any reason your code doesn't work, that might be because they sent you a new code already. So you hit submit. This brings you to your caller name. So put in my name. You can select if you're calling for yourself or for someone else. If it's for someone else, they're going to ask you to create a profile for that person. But as for myself, you select the purpose of the call from this drop down here. So I'm just going to say behavioral change or crisis. Next, it's a very, very good detailed enrollment form. So it'll ask you select your program and enter your waiver ID number. It's going to ask for your care coordinator's information, ask for your history. Some of the fields, it's important to know that it doesn't have an asterisk, but the fields that do have an asterisk, you cannot move forward until those are filled out. So if you don't want to fill all of this in now, that is okay. Just make sure that you fill in the ones that have the asterisk and then you say save and continue. If you try to do save and continue without doing the asterisk fields, it'll give you a pop-up saying one or more fields are invalid. All right. You can go and change this at any time as well if information needs to be updated. What I'm going to do is I'm going to log out just so I want to show you what a guest call looks like and just so you can see firsthand what the waiting room looks like. So if I was calling and I need an immediate crisis support, again, this is not in place of 911. This is if you're having a pre-crisis and you really would like to try and de-escalate it before the need of 911. This is where you would go. You would click next. We do need to have your first name in here just because we want to make sure that we're tracking it to verify for later to make sure we have this information on hand. You go to next. What it will do is it'll bring up, you're immediately in the queue. So then I'm going to hit cancel because it'll keep ringing and you might not be able to hear me. What will happen then is you'll be connected to a provider immediately. We do recommend, if you're able, to please fill out the enrollment form so we can set up that cadence and record of long-term care or for long-term care, but there's 2 options available to you if needed. All right. That is the most important part of getting started with this platform. I am going to turn it over for questions, and yeah, that was it. Thanks, everyone.
Thank you, Amanda. Yeah, we're open for questions now. Kara, I'm sure you'll keep an eye on this. And I just thought I'd start off, just to be clear for anybody that's wondering, the division is paying for this service thanks to American Rescue Plan Act funds. Don't need to worry about a charge to use the service. Don't need to worry about Medicaid billing or anything like that to use the service. It will be available free of charge to our IDD and ISW waiver participants. So just wanted to make that clear.
Thank you, Tony.
Thanks, Tony.
Yeah, one more thing for Amanda, maybe. You fill out that simple enrollment form.
Mm-hmm.
Do you need to enter your waiver number again next time you call, or you're good to go basically?
You're good to go as long as that's your profile as either the patient or the guardian. If you're a care coordinator and you have multiple profiles, that could look a little bit different. But once you enter that waiver number for that specific individual, you won't have to do it again.
There's a question in our chat, and it says, can only care coordinators enroll on behalf of clients?
That's a great question. Varun, I'm going to pass that over to you. I believe the answer is no.
Yeah, anybody can sign up that has the consent of the patient for the program, or the patient themselves could sign themselves up. So the system is set up so that it's flexible for however, because the scenarios could be unique for each patient, and so it really depends on who's taking care of the patient, if they're signing in themselves or if they're being taken care of by a loved one that has the consent to initiate the call on their behalf, or it's a care coordinator.
Thank you. Next question. What is the sustainability plan once ARPA funds are utilized?
I can speak to that to some degree anyway. We are going to be gauging interest with this for the next 6 or so months, Michelle, and there are a couple different options open to us. The Rural Health Transformation Fund program has got particular interest in developing telehealth programs, given Alaska's rural nature. There's also the possibility that this service could just be adopted into our Medicaid state plan and be funded that way. So we've got a couple of different options open to us to keep it going if it proves successful.
And thanks for sharing the website to enroll. Appreciate that. Someone had asked to share the website, so it's in the chat. Those of you who want to see that. Question, is this open to individuals currently on the wait list for ISW or IDD waiver?
I don't believe we've anticipated that availability at this time.
Thank you. And how are permissions received or tracked? And I think that means permissions to enroll. And if I'm wrong, you could just chat, or you could say it in the Zoom if you like.
Yeah, no, Kara, that's it. How are we assuring that permissions from, say, guardians are are actualized there?
So that can be done. What we had talked to the state about was that if there's a care coordinator, they would establish that permission and then they would share it with the providers that are on our system. However, that can be emailed in or sorry, attached to their to the account when they do set up their account. Or on a call, they could give permission on each individual call as well. But I think that the most simplest way is to have it when they do their enrollment and to have that permission given then, and then we know that that individual has permission for that patient.
Thank you. A couple more questions coming in. Could you speak more to the collaboration with current providers?
Lisa, do you want to take that one?
The collaboration with current providers, meaning the providers that are available for this contract, for this project. Maybe can you ask the question again? Sorry, more detail.
Sure.
I'm not sure I fully understand it.
It says, we'd like to know more about the collaboration with current providers. And it sounds like, tell us more about the relationship with the providers to this project, folks who
Got it.
would give care over the phone like this.
Okay. Thank you for that. When I heard current providers, I wasn't sure about providers that are already being utilized on the current IDD program. So we have a team of providers. So we are using providers that are licensed mental health clinicians. We also have medical providers, which would be nurse practitioners, physician assistants, and registered nurses. So the providers are licensed in the state of Alaska. They are trained with specific Alaska Cultural Foundation training to just help the cultural piece of it. And then again, just licensed clinicians. Thank you. Oh, clarifying if the person has a therapist. Thank you. Okay, got it. I get that. So if they currently have a clinician, it doesn't have to be an ongoing relationship with the providers that answer. So we have looked at both ways. Actually, we were talking earlier today. So if the patient does not currently have a licensed mental health professional, they could utilize this service in that way. We've had discussions about making sure that the pool of providers, if it is a non-urgent or urgent call, basically anything other than a crisis call, they could have the same clinician that they talk to each time for continuity of care. So that is an option. And if they already have a clinician, this would be an additional service. So it would not interfere with the relationship with their clinician anyway. If they wanted to continue with this clinician, they could. If they wanted to continue utilizing their current clinician, they could. Does that answer the question?
Yeah, I think so. Just in the moment of crisis, if somebody
Got it.
says, I'm going to use this service, how is the communication from the therapist that's used through RingMD to the therapist ongoing? Or is that going to be the staff's responsibility to say, I called this service? Because I'm not clear if staff are sitting in right next to somebody. Oftentimes people with IDD are still seeing clinicians privately. The staff are not in the room with them. So just to get a flow of how this works.
Thank you for that. We have actually talked about that also. So ideally, what we would have is a release of information from the entire clinical team. What we're going to have is the care coordinators in Alaska will be notified that their client called or their patient called this service and utilized this service. Now, depending on the release of information, which we've really discussed getting release of information to be comprehensive, the patient can say, here are my care providers, and I would like them to be notified. And that is ideal and what we would really like to do, again, for continuity of care and so that everyone is clear as part of the treatment team. This patient utilized these services and this is what they utilized it for, so that their current ongoing providers are aware of how they're utilizing the service and even how to help for their treatment planning purposes. Does that answer your question, Michelle?
Yeah, I think it's just a lot of if someone's got an ongoing relationship with a clinician and
Mhm.
goals and objectives that they're working on within a treatment plan, and you have
Mhm.
a crisis moment, and the crisis clinician doesn't have all the details, just want to make sure that, we don't start to um, make recommendations or interventions that are counterproductive for a,
Mhm.
yeah.
Yes, I can understand that completely. And again, that is going to be based on the release of information that they have. So ideally, we would have all that information ahead of time. It's my understanding that right now, that is going to depend on how much information the patient or the patient's family wants to give up front. But ideally, we would have as much information about the patient as possible. We are looking at not just utilizing this as crisis management care, but the goal in decreasing the hospital stays would even be urgent and non-urgent care. So proactively having that engagement being in addition to the treatment team, not just in the state of crisis. That way, if the patient is in a state of crisis, we have a background information, we have a rapport. That's one of the things that we've looked at as far as when I think Amanda mentioned when a patient enrolls, we proactively reach out to them so that we can have those conversations. Hey, who's part of your treatment team? What is it that you would like us to know? And then that would help smooth the process if they do need to utilize it in case of an emergency.
Thank you. Go ahead, Tony.
Thanks, Lisa. I'm just wondering, based on your experience in other states, can you describe some of what you typically see, how people are typically utilizing the service for us?
That's a really good question. So the way I've seen it in the past is that it is really going to depend on the patient, right? Of course. So there are going to be some patients that utilize this as sort of a social work aspect. So they're going to call in to get phone number services. I have a question on my medication. I have those type of conversations, right? So that'll be what we considered a non-urgent. Then there may be patients that are urgent. They are feeling a bit overwhelmed. They need to be de-escalated, and then we set an appointment for them to see a licensed clinician. It may not be something that they need to be um, in a crisis mode, so they can still utilize that service. Quick de-escalation, get on the tools and techniques, which much to Michelle's point is why we look to proactively introduce ourselves, and so that we know more of what they're working on, so that when the patient calls, there is a sense of being familiar with that patient and what's going on with them. And then of course you're going to have patients that call in a state of crisis. Yeah.
Thank you.
You're welcome. Thank you for your question, Tony.
And just for those of us who might be just listening to this now or later, there's a question about accessibility for deaf and hard of hearing, TTDY option, and the answer is yes. It supports TTD or TTY access. Question says, does a potential client need a mental health diagnosis before enrolling?
I think they just need to be on the waiver, right? Is that correct, Tony?
Correct. Yeah, no, there's no expectation whatsoever that there be a behavioral health diagnosis to access the service. It's enrollment in one of our two IDD waivers.
Thank you.
I also just want to say again for the recording, because I'm not sure we said it out loud. There was a question in the chat about what technology does a family need to use this service or need to have to use this service? And the answer would be just access to the internet. So it could be your phone, laptop, tablet, computer, whatever you have that can get to the internet, you can use. So.
Here's a question. What is the waiver ID number in the registration? Is it the case number, a Medicaid ID, or something else?
It's the IDD number, right, Amanda? The IDD ISW waiver number.
Yeah, it's your waiver number. I
Harmony
saw
ID.
just responded. Yeah.
Harmony
And
ID. Thank you.
yeah, Harmony ID. Yeah. Thank you.
You can come in. Miss Malda, we're almost done.
Did you have a question? We can hear you. Did you have a question, Lisa?
I think that was Lisa trying
Okay.
to multitask.
Yeah,
Um,
I get that.
I apologize. There was someone at the door saying, come on in. I can't get up.
No worries.
If there are no more questions, I just want to make sure that you know that if there's a question that comes to you later, you're thinking about this a little bit more, you're trying to utilize the platform, you are more than welcome to reach out to us directly. I'm going to put my email in the chat. It's amanda@ring.md. So please feel free to reach out to me, someone from SDS. We just want to make sure that your questions are answered and you can fully access it in the way that you need to.
And there's a good question in our chat. What are the determinants of success in this program?
I can answer for the state, but I'd love to hear what RingMD says about that from their end. I mean, it's going to be both quantitative and qualitative as far as I'm concerned. We want to see that it's actually being used. We've got between ISW and the IDD waiver about 2,500 people enrolled. It'll be good to see how many take advantage of the service. I recognize that many of those folks won't need the service in the course of the next several months, but is it being used? And we're gonna quality assure this with RingMD regularly to make sure, hear how it's going, troubleshoot any issues that are occurring. But we have not established specific benchmark things at this point. This is something of a pilot project for us, and so then if we move into a more permanent, long-term footing with it, then we'll be establishing more specific benchmarks, I'm sure. But RingMD, do you have anything to add to that?
Yeah, I think that from our perspective, what we typically look at is a number of different areas. I think primarily what we like to see is utilization. As people become more familiar with the option that they have through telehealth, how often are they using it? One in a program like this where there's a care team and there's patients. If a care team is using the program for multiple patients, typically that's a good sign. That means that they're getting some value from it. Like you mentioned as well, Tony, qualitative is important as well. So we have internal tools that we use to see how the quality of the calls, how individuals are feeling about the visit that they just had. Monitoring that quality is important. And then on a macro level as well, like a lot of that is experiential, where you survey individuals that have used the program and what impact it's having. I think that one of the benchmarks of the pilot is also to avoid unnecessary ER visits. So I think we can extrapolate that data sometimes as well from looking at the utilization, looking at some trends. So we'll be looking at different analytical dashboards to see what impacts that this program is having. And then Elisa, I'm sure, has more on the clinical side. I'm sure you have some benchmarks that you analyze as well. I know because we talk about them all the time. So I'll let you talk to more of the clinical side things. But there are a number of things that we'll continue to look at throughout this program to see how it's being used. And I think that when we are iterating these type of programs, we always love feedback from the users, from the patients that are actually impacted. If you're having any challenges, if you find some areas of the technology difficult to work, please do give us that feedback along the way. We love modifying and improving and enhancing our program because it not only helps you, but it helps subsequent users of and patients of the programs that we work on. So we look for feedback all the time, and we really welcome that. Both positive and negative is always constructive to us. Lisa, from your perspective, is there things that you'd like to share about that as well?
Thank you for that. Yes, just small things. I think utilization is of course one of the benchmarks. Another benchmark would be the outcome of the call, right? If we can help divert someone from going from crisis call to an urgent call, that would be a huge benchmark for us. If someone is in crisis, one of the benchmarks would be, did we divert someone harming themselves? Were we able to intervene in that way? Those are some of the interventions that we'll look at, and then we'll also have tools on the call. So we use the Columbia Suicide Rating Scale to see if we diverted, we were able to avoid someone harming themselves. And those are some of the benchmarks that we use, other clinical assessments. So we'll be able to have more benchmarks the more people call in. So if someone called in at this date, and they were scoring high on either the depression scale or a Columbia Suicide Rating Scale, they were higher risk. They called again the next week and they were decreased their numbers. Then that's something that we would be looking at on a continuous basis when we're interacting with people, keeping those consistent clinical skills, and looking at what the changes are.
Thank you. A good
Yes.
question in our chat.
Mhm.
Does the service follow up if the person's regular clinician has been notified? And go ahead, Michelle.
Yes. Michelle, you have all the good questions today.
Oh, actually, I think that was my other, with their two
Yeah.
Michelle line. Yeah, go ahead.
So yes, the clinician would still follow up even if the patient had an ongoing clinician. Remember, we are here to be collaborative. So we want to notify the treatment team that this patient has utilized the service, what services they have utilized, and what the outcome was. And again, that is going to depend on the patient signing the release of information so that we can pass that information along. So when you guys are looking at patients to refer, encouraging them to sign these releases of information so that we can communicate as much as possible to the treatment team, and adding everyone on the treatment team, um, everyone on their treatment team, so that way we can easily communicate with everyone. So that's one of the things that when Amanda mentioned reaching out and talking to, once a person signs up, talking to them about the program, that's one of the things that we'll remind them. But yes, we would still have a clinician follow up with them and do their due diligence. Is there another?
I'm not
I just
seeing any right now, but go ahead. Go
Okay.
have
ahead.
a quick follow-up question about, do we currently have a baseline of hospitalizations related to IDD/mental health in Alaska, or CIR analysis to just know what your baseline is at this juncture before we implement this?
That's a great question, Michelle. Not to my knowledge, but we could look into whether we can do that. That would be helpful in terms of the evaluation. I don't know that we've done that work to this point here at the department. I was going to say, will clients? There's a question from Cheryl. Will clients be able to establish a relationship with a particular RingMD staff, or is that not part of the design? Can you answer that, RingMD?
Yes, I can answer both those questions. So one of the questions when we initially meet someone, we will ask, how many times have you visited the ER last year? So Michelle, to your point, we won't have the, long-term data, but we at least have within the last 12 months data, so that we would get a baseline, because it's important for us too, right? As part of our KPIs. And the goal is, yes, for a client to establish a relationship consistently with the same providers every ND. Yes, that is one of the goals, and that is one of the designs of the program. The only, I think, part of that would be if a client calls in for crisis, we could still have the regular staff that they are looking at, that they are working with, reach out to them after the crisis. But if it's in a crisis, it's going to be whoever's on call for crisis. But yes, we are looking for them to establish a relationship. That's the goal, not for it to be kind of a one-time call and that's it. Thank you for that question, Cheryl.
Anything else?
I'm full of questions. Sorry today. Hopefully it's
We
helpful.
love it.
But also, I wanted to go back to Neve's question about, helping people that are on the wait list or a little bit outside. Because I think a lot of people that are served by the waiver, at least in our house, have a treatment team, have connections with the CDC. But the people that are waiting for mental health services could so benefit from this. So I don't know if there's a juncture during this pilot where we see, oh my gosh, maybe our current clientele are not utilizing it, but if we expanded it, we could be so beneficial, and certainly see this as being a help to those who are living more rurally and don't have access to urban clinicians for sure. But we know that there's a wait list for a lot of people wanting mental health support.
Michelle, may I ask, and you're speaking about folks specifically who are waiting to get on the IDD or ISW waivers, or all folks generally? I'm not quite sure I'm tracking.
I think people waiting for mental health services that
Absolutely.
also probably have a disability. And maybe they haven't gone through all the diagnostic hoops for that, or there may be families who are just waiting. I'm thinking of many families that have kids with autism that are they're on the wait list, or they have opted not to try to get on the wait list, but they desperately need the support of services and are waiting. Our mental health system isn't as robust as it needs to be in Alaska, which is why you're doing this. But just thinking if there's a way to expand to those families would be amazing.
Great. I mean, people who are on the waiver or seeking to be on waiver services don't qualify for the waiver services as well. It sounds like you're suggesting. No, that's a great thought. And again, I'll just be frank. We wanted to get this project going and out there, and we will, I think, have some time, if it can prove successful, to look at how this could be used to reach more Alaskans of various needs. So it'll be a great experience, and I'll bear in mind what you're saying. I think as the Rural Health Transformation Fund, comes as we learn what we're able to do, and if telehealth is one way we can reach rural Alaskans in particular, that this could be a way to demonstrate that a program like this is needed.
Yeah, I'd just like to kind of piggyback on that. And thank you, Michelle, for catching my comment, because it's exactly what I was thinking. And I think there's definitely room. I mean, I think, yeah, if this is kind of the first wave to kind of see how it works, get the information out there, I think it would be really worthwhile to find a way to maybe link this in with the DDRCs and kind of maybe like the person that's helping people to get on the wait list for services, that maybe this is a role that they could perform with getting a profile set up in the system if we extended it. And then, of course, with like current work with infant learning programs in Alaska, like really seeing that we have such a huge gap in services from families that are exiting like early intervention, going into the school districts, really kind of significant gaps between like age 3 and age 10, especially. And so, yeah, as we're thinking about the rural health funds coming in that is just something that I'd be really interested to see us putting resources towards.
Thank you. Another thought on the need we have right now to be a little bit limiting in who the service is available to. The American Rescue Plan Act funds in this particular source are intended to be designed to enhance, strengthen home and community-based services. So that's why we're kind of starting small with the people that are on the waivers, have their support plans. And so that's a condition of the funding source right now. But again, I'll emphasize as the project gets underway and we see its capability to extend beyond that population, we'll sure take note of that.
In this vein of discussing expansion, I think that one of the things that we would ask, and you're the experts locally, and you're working with the patients locally, what we'd like to learn from every program, because it is unique. Every time we implement, no matter how similar the parameters might be, the actual realities when you are in the program are unique every single time. I would really encourage you to use the program to start, enroll patients, tell us what's working well for you, what isn't working well for you, so that we can continually improve it. In these early weeks, in the first month, in the first 2 months, we really like to learn as much as we may have done this many times. We may have done it in elsewhere. We've done a lot of work in Alaska as well in the past, but every program is unique, and we really want to learn and we really want to improve. So, in order to, before even expansion, we just want to make sure that we get it right, that we're solving the problem that you're seeking to solve, and we're serving you the way that you need to be served. So, I really encourage you to start using in the way that you are using it, or are able to use it today, and allow us to learn how we can improve and get better.
Question in the chat says, what is the data that will be shared between RingMD and SDS? Region, type of service?
Yes, so there's a whole host of data that we can share on a macro level of who's signing and accessing the service, where they're accessing it from, times of day that they're accessing it, how often they're accessing it. There's a number of dashboards that we'll be sharing with you, and then if there's areas that you start thinking, or SDS starts thinking that, okay, well, I want more data on this, or this is interesting to me, then again, it's a bi-directional discussion, where if there's certain areas that you find very interesting and compelling, we can give you more information on it, and build it into both a dashboard that you can access at your at the time when you want to access it, and of course we'll have the monthly reports that we'll be sending out.
And there's a question that said, does the enrollment process begin today if there is need? And the answer is yes.
It started on November 4th, so yes.
We are live.
Yeah, of course, we put the web link in the e-alert that we sent out last week. I wonder, it makes sense to have we put that in the chat here today again?
We did, yes.
Okay.
Yeah.
Great.
Yep. And then I guess what I would also say, just in the reiteration of enrollment, and based on the conversations and the great discussions we've had in this call, is that it would be great to get your loved one enrolled early. Have the introductory call with our provider team so we can know the patient, understand their needs before a crisis does occur. That way that we can just make sure that, we're ready and prepared for when that happens. So even if there is no need right now today, we definitely encourage you just to enroll and just get the information in there, so that when you need it, you know where to go, you know how to access, you can log in, and you're just prepared.
It's another good question, probably more for SDS. If someone uses RingMD on a crisis basis, does that require a CIR? Is it considered a medical consultation for CIR?
Boy, that's an excellent question. I am going to, I'm not sure the answer. Caroline, do you have any thought on that?
My thought is that we would review the regulation. I mean, it says for medical intervention, when medical intervention is needed. So to me, that, if somebody's in a crisis situation, that would indicate, yes, a CIR should follow. No different than, what already happens when people are interacting with the medical community for emergency situations.
Thank you. Yeah. I mean, and I paused because I know we're going to be working with RingMD to look at the calls they're getting and how they're being handled, and so there'll just be two ways that we'll be able to provide some quality oversight to this project. Anything else? I'll say I was not anticipating so many excellent questions, but we have about 5 minutes left. If there's anything else before we let it go. All right, Carol, shall we close it
Mhm.
down?
Yeah, I think folks are good. Thank you so much for participating with us today. We've gotten some great information. We truly value your engagement and interaction with us, helping us learn more about shaping this project. And especially thank you, Tony, and our Ring MD professionals for giving us this great information. Everybody who attended, uh, keep a lookout for follow-up email. Well, our teams will talk about what we should do next to help get this information out and reshape it for more people to know. But we will have a recording and that'll be posted on our YouTube channel. And so we'll have a link. And that's what I know right now. So again, thank you so very much for being with us here and look forward to connecting with you again. I'll go ahead and close the
Thanks,
session.
everyone.
Thank you.